All right, hi guys. So we're gonna do. I'm gonna go ahead and this semester, excuse me, instead of doing PowerPoints, I thought it would be really, really great for us to do voiceover ATI Mental Health Engage. So that way you're getting the information straight from the source. You're getting it straight from ATI. You're learning how to read the Engage. You're learning how to engage with ATI. And I think this will really be helpful to help you guys be like more well rounded students and to prepare you, to better your studying and also help you for next semester. So, when we have your mental health, when you are looking at your voiceover lectures, they're all going to be in this kind of format where we're looking into our engage and we're actually like going through the information. Um, and so they're not going to be really long videos. I don't pay for the platform that I use. And so they're only going to be 30 minutes or less. And they're going to go through a lot of the information. Your job is to listen to this, review this information, make sure that you take notes, and then do the post quiz to make sure that you actually like learn something. Knowing how to apply the information is like key. Okay, so let's get into it. So the first thing that we're going to talk about is your foundations of mental health, and there are a lot of different ones. We're talking about legal and ethical concerns, continuum of treatment, evidence-based in mental health, and foundation concepts of mental health nursing. Now, I'm going to go ahead and only touch on the legal and ethical considerations and the foundational concepts of mental health nursing. It's going to be your job to go into the continuum of treatment and the evidence-based practice of nursing and go ahead and skim through that information so you can get that information. Okay, so we're going to start with the foundational concepts of mental health nursing. And we're literally just going to go through some of this information. So by the end of this, let me move this over to the side. By the end of this, you should be able to discuss mental health, mental illness, mental health disorders, explain factors affecting mental health, identify bias, discuss DSM-5 TR, explore legal, ethical, political issues related to mental health, and examine cultural sensitivity care within the scope of nursing that meets the needs of diverse clients. Okay, and so first we're gonna go, and I'll make this a little bit, just a tad bit smaller, just to help me out. When we talk about how do like the standards of care, when we talk about the tool that providers use to help diagnose, this is the Diagnostic Statistical Manual of Mental Health Disorders. 5 TR. TR is text revision. So this right here is a diagnostic guide used by mental health providers. The manual contains descriptions, manifestations, and additional criteria needed to diagnose a mental health disorder. So this means that you can't go into the doctor and say, oh, I've been feeling really sad for the past couple of days, and the doctor says, boom, you have depression. No. This is the DSM-5 TR is a booklet that says, okay, if somebody has major depressive disorder, they have to meet these criteria and they must have this criteria in this length of time. It's very detailed. And then if the patient meets all of this, then we're going to diagnose them with major depressive disorder. And so it's very yes, it can be very subjective, but it tries to also be a little objective, with making sure that we have a data points to to pinpoint disorders versus people just aimlessly, diagnosing people with things that are just not appropriate. Okay, so a couple of core concepts of that you need to make sure that you know. We have mental health. This is a condition of well-being in which an individual can positively function in their daily life and his ability to cope with stresses as they appear. So, mental health, a condition of well-being. They can positively function, okay? This is huge. positively function in their daily life. They can balance their checkbook. They can go to work. They can take care of their children. They can take care of themselves. They can function, and if stress comes to them, they can still function even though that they have stressors. So for instance, if I woke up this morning and I stubbed my toe, me being able to positively function is, okay, I stubbed my toe. That really, really sucks. I just need to get on with my day. Versus I stubbed my toe and now I'm screaming and yelling and I am making this big, huge deal and it's just like completely exploded. You're not able to function, okay? When we talk about mental illness, according to the American Psychological Association, mental illness is any condition characterized by cognitive and emotional disturbances, abnormal behavior, impaired functioning, or a combination of these. When functioning is impaired, they cannot go to work, they cannot pay their bills, they cannot take care of themselves and other people. When functioning is impaired, this is mental illness, okay? If you're able to function, you have mental health well-being. If you are unable to function, this is mental illness, okay? All right, and then we do need to make sure that we understand there's a couple of other definitions. I promise this won't be just me reading. But stigma, this is a negative attitude or discredit against an individual, and a bias is a stereotype, prejudgment, or even discrimination against a group of people and in comparison to another group. So, if you have a classroom and you've got kids that are, maybe slower readers versus you have advanced readers, a stereotype will be, the slower readers, they are not gonna, do well in life because they read slowly and they're gonna fail at school, versus the really, the good readers, they're all gonna excel in life and they're gonna do great. That might not be the best example, but you get the drift. Okay. So mental health, the nurse needs to make sure that data is collected to make sure that we have the client's views of the mental illness, and report any, and to be reported to the supervising RN, and this can vary. All right, let me just hide this. All right. So when we talk about different mental health treatments, we want to make sure that we are understanding that the biggest thing that we want to do when we're talking about treatment is to improve the client's health and sense of well-being, okay? We want to help make sure that we're adding prevention, we're doing screening, we're assessing, and then we're treating patients based on their health disorders or any sort of behavioral conditions. So prevention, what does prevention look like? This looks like so let's just talk about depression. Educating about depression. What does depression look like? What are some risk factors for depression? This is our prevention, okay? We're educating. We are, helping people, participate in activities, providing, patients to understand what the risk factors are. We talk about screenings. We can do our screening assessment. So this is like our PHQ-9s. This is determining if the patient has major depressive disorder. We can do, our Columbia suicide screening. This is also then talking about, is the patient suicidal or not? And then if the patient does, and then our assessment for a patient that has depression, they're going to be really, really sad. They're going to have loss of interest in different things. They may not pay attention to their hygiene. They may have decreased appetite. And then when we talk about our treatment, okay, what are we going to do to treat this patient? Well, we're going to probably put them in therapy. We're going to give them some medications in hopes that once these medications and these treatments have been available, then they're going to be able to have an improved quality of life. They're going to have functioning, okay? And so that's how we kind of look at what mental health treatment looks like, okay? So we are doing prevention, we're doing screenings, we're assessing as it is needed, providing a diagnosis, but as nurses, we're not diagnosing, but then we're helping with treatments, okay? Um, and then, ATI does talk about how mental illnesses are conditions involved in changes of emotion, thinking, or behavior. Mental illness is associated with distress or problems in functioning in school, work, or activities. We've already talked about this, but this is just like a little illustration to drive that point across. When we look at different types of disorders, so different disorders can impact, well, the disorders are all going to impact someone's functioning, okay? And so there are different types of disorders. We have anxiety, somatic, personality, mood, schizophrenia, spectrum, so on and so forth, okay? And we'll talk about those a little bit later. When we talk about the mental health continuum, so I'll make this a little bit smaller, but this is right here, the mental health continuum. So we're looking at this, it looks kind of like a gas meter. And if somebody is doing really, really well, they're excelling, they're thriving, they're going to have more well-being. The more that they deal with struggle and crisis, this can tip somebody into mental illness. So when we talk about the continuum, we can go ahead and click on this. Excelling is often viewed as mental health wellness and is absent of any illnesses or the absence of illness symptoms. When someone is thriving, the stress does not cause a significant delay of impairment. When people are surviving, it's not a state of distress, but a state in which problems may need action that can be recognized. So you may feel as a nursing student, you're just surviving, okay? You may feel on the edge. You may have a little bit of nervousness, irritability, distraction, withdrawnness, but you're not in a state of distress. You just are having a lot of these, you're just getting through. When we talk about struggling, it's the patient may feel worthless, worried often, and that life is misery, but all hope is not lost. So again, this may also look like a nursing student, but all hope is not lost. You guys will be graduating soon, and then, hope will be restored. But when we get into crisis is often viewed as a mental health disorder end stage. So this is where the client is experiencing severe symptoms and needing assistance. Patients are going to have impairment in sleep, appetite. This is when someone gets to like an acute issue or like an acute state. So if someone is acutely psychotic, they're in a crisis. And then make sure you don't need to worry about this diathesis stress model. We do want to talk about risks for mental health or poor mental health. So some are modifiable, others are not, but lack of social support, housing, inaccessibility, adverse childhood experiences, which we'll talk about later, unemployment or underemployment, food insecurities, lack to access or poor quality, educational inequities, economic inequities, and unhealthy or unsafe surroundings / neighborhoods. So some of these are modifiable, meaning you can change them, but some you really, if you don't have a job, you can't buy food, your housing may not be great. You also have income issues. You may have to live in poor housing or unsafe surroundings just because that's cheaper housing. Then you have 5 of these things that are all piling up in risk factors for mental health. So this is why we have patients that live in not great areas, and they have high risk for depression, they have high risk for anxiety, they have high risk for maybe bipolar, maybe due to adverse childhood experiences and trauma, all because of their situations, okay? And although it is modifiable, meaning we can change them, Is that really, can you really sometimes change your surroundings? Can you really sometimes change the fact that you're unemployed or underemployed? Yes, you can change it, but if no one's hiring you, then you can't change that, right? And so when we're looking at people, like especially patients that have mental health issues, we need to look at them as a whole person rather than just their situation, how they're not coping appropriately or whatever. And then adverse childhood experiences. So when we talk about what adverse childhood experiences, this is ACEs. This is traumatic or negative events such as physical, emotional abuse, neglect, sexual abuse, dysfunction, home life that increases risk for depression, anxiety, behavior, and substance use disorders, as well as other mood disorders and psychosis as well. And let me see if they actually, I'm going to go ahead and pull up our ACEs screening. ACEs screening. Here we go. So this right here is ACEs Aware, and this just looks at our screening tool for children. And here, ACEs questionnaire. So we talk about our ACEs. So if you look at this right here, below is 10 categories of adverse childhood experiences. You know, we're going to check mark next to each that someone experienced prior to their 18th birthday. Okay. So what are some of the questions? Did you feel like you didn't have enough to eat, had to wear dirty clothes, and had no one to protect or take care of you? Did you lose a parent through divorce, abandonment, death, or another reason? Did you live with anybody who is depressed, mentally ill, or attempted suicide? Had a problem with drinking or using drugs? Live with? Parents ever hit, beat, or punch or threaten to harm you? Did you live with anyone who went to jail? A parent ever swear at you, insult you, or put you down? Did you have a parent or adult in the home ever hit, beat, or physically hurt you in any way? Did you feel like no one in your family loved you? And did you experience unwanted sexual contact, such as fondling, oral, anal, vaginal intercourse, blah, blah, blah. And so based on the number, you put right there, and based on if the patient believed that their health was affected one way or another, this, like this says, experiences in childhood tell one part of the patient's life, and there are many ways to heal, but the more they have, I think it's 2 or 3 plus, but the more ACEs or adverse childhood experiences the patient has, the more they're at risk for developing anxiety, depression, substance use disorders, bipolar, potentially schizophrenia. And so these are going to increase that risk for these patients. And so it's really important that we are looking at this and looking at, different protective factors and other things that can help support children as they get older. And then when we talk about adults, what are some things that we can help support adults through resources in the community, therapy, social groups, being a person of support to somebody as well. And then we do talk about protective factors. This includes social support, health screenings, mental health resources, which can minimize the impact of exposure to adverse events. Okay, and you guys can read some of these on your own. We're going to go ahead and move on. We already talked about stigma a little bit. So stigma, public, self-institutional, and then bias, stereotypes, prejudgments, discrimination, explicit and inexplicit. So make sure that you kind of review some of these, and you can get some of the, what institutional stigma is, self-stigma, public stigma, this, that, and the third. And just, if I were you, just look at some of these definitions right here, just so that you're aware of some of them. So if you see something, if you see, one of these, you'll know exactly what it is. We already kind of talked about the DSM-5 TR. We don't really need to go too much into that. You don't need to know much about this. We'll talk about it a little bit, but the biggest thing that you need to know is that the DSM-5 TR is I believe it's this one. Ooh, oh my God, I got it wrong. Oh, is this select all that apply? Okay, so the DSM-5-TR assists providers in diagnosing their clients with mental health disorder, contains criteria, but it does not provide treatment modalities such as medications. It does not contain nursing care plans, and it does not talk about any medical issues. So it's just mental health disorders, and that's it. So you wouldn't see like hypothyroidism or hyperthyroidism. You wouldn't see any of that. When we talk about some of the legal, ethical, and political issues, this kind of takes us back to fundamentals when you guys learned about beneficence, autonomy, non-maleficence, and justice. Please make sure that you know this information. You will be tested on it on my exam and on the ATA Proctor. So make sure that you just know these definitions and just know how to apply them. Make sure that you are aware of what the Mental Health Parity and Addiction Equality Act is, as well as the Patient Protection and Affordable Care Act, as well as the Healthcare and Education and Reconciliation Act. These are essentially laws that require insurance companies and health plans to provide coverage for mental health illnesses, just as they do with other like medical illnesses, okay? And so mental health coverage cannot be restricted due to any sort of financial limits such as deductibles, treatment limits, or co-payments. So if somebody has been to rehab 10 times, insurance still has to cover that rehab 10 times. As a reminder, while working with a client who has a mental health disorder, the nurse should remind them that their information is only shared with those who are directly involved with their care. It is important that we do understand this one thing that's called duty to warn, okay? So this is only given, the healthcare provider has a duty to warn when there is threat from a client to another individual that causes them harm. So if the patient says, I'm going to kill my mother, she lives at this address, the healthcare providers must warn the mother. Okay, now I've had a patient say, I'm going to kill that kid that goes to that school 10 miles away. Okay, well, what's the kid's name? I don't know. Where does the kid live? I don't know. Do you have the means to kill the kid? No. In those instances, they don't have the duty to warn. Okay, they have to know who the individual is, have the means, and all of these things, but either way, healthcare providers have the duty to warn. And then when we're talking about culture competence, I mean, this is really good, just providing this like statement right here. Providing culturally competent nursing care is closely related to client-centered care. As a nurse, it's vital to develop skills for care that involve in gaining knowledge about other individuals' culture, and a necessary component when caring for a client for diverse backgrounds. So, if you're caring for somebody who's, Hindu, you're caring for someone who's Muslim or Catholic or Protestant or Buddhist or whatever, we need to make sure that you're understanding, the things about that person's culture as it relates to their religion. If somebody, is different races or different cultures that people have, it's really important that you as a nurse just are able to understand what those patients are going through and how it affects them. A nurse can assist that the client's culture or spiritual practices have been identified by the healthcare team. And then that's it. This is our little summary right here. You can go ahead and look at that on your own. But we kind of went through this really quickly. If I come out of this and I go back to the... if I come back to the mental health and the legal and ethical and safety concerns, It does talk just a little bit about ethics. It does talk about milieu, which milieu is just making sure that the environment that the person is in is therapeutically safe for the client. So making sure that, you know, there is no loud noises, making sure that doors are locked, there's a safe environment. That's essentially milieu. When we talk about ethical, this is, you know, talking about informed consent, confidentiality, boundary violations. I think you just need to review some of those definitions. And then the other thing that ATI really presses on, and I will press on too on my exam, is restraints. So clients have the right to be free from inappropriate chemical, physical, or seclusion. Okay, so you need to make sure that you're understanding some of the risk factors that come along with these restraints and seclusion, as well as de-escalation strategies, different interventions, and then seclusion versus timeout, seclusion versus restraint, chemical versus physical. Make sure that you review this because we will talk about it on the exam, and we will also it'll also be something that is pretty heavy on your ATI proctor. I'll go over the de-escalation strategies just a little bit. So when we're talking about de-escalation, especially if the patient is agitated or aggressive, the first thing that we need to know is we're assisting the client towards self-control and maintaining a self and therapeutic milieu. We're using clear and calm communication, ensuring that our body language is non-threatening, being supportive, listening to concerns, making sure that we're setting boundaries, making sure that the client making sure that we're creating a sense of trust with the client, and ensuring the physical environment supports the milieu as it relates to reducing sound, lowering light, having a calming activity, and again, making sure everything around the patient is safe. Okay, so go ahead and review this. It's not a whole ton. But just make sure that you're aware just of just a couple of things as it relates to restraints, when we restrain, when we don't restrain, and then restraints in older adults. Please make sure that you review this information as well. So that is about it. I hope that this was really helpful. Make sure that you do look at some of the summaries. The summaries are really, really helpful. And then ATI always has flashcards and a glossary to help you with understanding the information a little bit more. All right, I'll see you in the next video. Happy studying.